Give him a warm welcome as well. Dr. George Christ.
Thanks very much. And I'd also like to pay my respects to the traditional owners. Thanks. And I would like to thank the organisers for asking me to come along and talk about health, because it's really important to put health on the agenda. It's often overlooked. And I'll try and very briefly explain why we should be concerned about health, what it means and why it might be in danger. First of all, I'd just like to clarify what I mean by health, because when health is talked about in public, it's often talked about in the context of illness. We often talk about health care, which really means illness care. So we really need to think about health, because health is actually defined as a state of complete physical and mental well-being, not just the absence of being sick. And if we're going to stay healthy, we have to understand the factors that determine what keeps us healthy, and we have to look after them. There's a useful analogy which I'll briefly mention called the river story, if you've not heard it, which is set in a village by a river. And one day one of the villagers notices somebody in the river, and he hears the cries of a child in the river and runs down to the river and rescues them and resuscitates them. The villagers try and resuscitate the child, and then before they know, there's another one and another person and more. Eventually the villagers realize no matter how well they organize themselves, or no matter how much sort of effort they put in, they're not going to stop everyone from drowning. The only solution is to go upstream and find out why people are ending up in the river. It is, of course, the story of prevention and preventive health. If our health services are going to cope in the long term, we have to look upstream and find out why people are getting sick in the first place. And that's the reason that our health outcomes now are generally so good, is because that's what we've been doing for the last couple of centuries. In fact, all of the advances that have been made that lead to our long and healthy lives are because predominantly public health interventions. And the reason it's of such concern now, of course, is that the two areas in health where most of this happens, in public health and in general practice, are the two areas that are being targeted by this government most specifically. One of the first actions that the Abbott government did when they got in was to abolish the National Health Preventive Agency and the National Prevention Health Agency, and also defund other public health bodies. And of course they're attacking general practice through trying to push in a co-payment, which will specifically disadvantage the most needy in our society and those most in need of healthcare. But also they're trying to put in freezing the rebates for the next 4 years, which will have much the same effect. So there are also a range of factors, of course, that are outside of the health service, and we need government intervention and action to actually address them. If you look back at the major advances over the last couple of centuries, they're clean air, clean water, food security, a range of occupational injuries and accidents. There's a wide range of things that can't be done by individuals. They have to be done with the input of governments through regulation and through the building of infrastructure. And of course, our government is not on the same page here. The things that are actually impacting our health are largely being neglected and overlooked. Someone's already mentioned roads. It's a very good example, basically. If we build more roads, we will have more air pollution. It already kills 3,000 people in Australia's 4 biggest cities. If we don't build rail, if we build more roads, more people will use cars. Obesity, diabetes, heart disease, the big killers, the big risk factors for our health will get worse, not better. If we're going to safeguard our health, we have to address these things. Mining coal, we're subsidizing coal by $4 billion a year or so. And this is killing people all around the world. It's a major health. We know it's a major health risk. And yet our Prime Minister is telling us that coal is good for humanity. At the same time, basically obstructing and stopping renewable energy with all the health benefits that it has. There are countless examples, and just about every area, basically, where there's environmental damage and degradation, there are also health consequences. And when basically these health risks and costs are being outweighed by short-term vested interests, well, basically what it means is that government is trading off our health for commercial interests, which is completely unacceptable. There are also social determinants of health. Briefly, I'll mention, poverty is clearly a big risk factor for ill health. Poverty determines health to some degree, but not just in absolute terms, but also relative terms. The differences between distribution of wealth, the gaps in society, the greater the inequity, the greater that the health is impacted, and a range of social outcomes too. The more equal societies, the better all of our health is, not just the poorest, but right the way through all groups in society. Fairer societies means healthier lives. And again, the government is ideologically unconcerned by inequality. Tony Abbott in 2013 said, "In the end, we have to be productive and a competitive society. Greater inequality might be inevitable." Well, that's more people in the river. That's more people drowning because of government inaction and ineffectiveness. It's no surprise, probably, that inequality was not mentioned in the intergenerational report once. The governments are clearly not planning on doing anything about it. And similarly, climate change got short shrift too. Climate change is now the biggest threat to health this century. It's widely acknowledged by all international public health agencies through direct effects, for example, through heat waves, extreme weather, and the mental health consequences that occur, but more importantly through the indirect effects affecting food security, food production, water security, the transmission of diseases, the functioning of ecosystems on which all of our health is dependent. So it's really of concern when the government actually is trying to obstruct national and international action on climate change, which is the biggest determinant of our future health. So the good news story, if there is one here, is that there is an opportunity, and that is that all of the things that we do that can improve our health, or can improve, are also things that we can do to combat climate change, and vice versa. The way the infrastructure we build, how we source our food and produce our food, how we design our cities. There are many opportunities by which we can basically both combat climate change and also improve our health. And it's really urgent that these things are done now, because we're sort of running out of time. So it's why we must change direction and act on health. So what can you do other than change the government? Don't forget to talk about health. Basically, in all the conversations that you have on all of these subjects, they have human rights dimensions. Sorry, they have health dimensions. When you talk about human rights, when you talk to people about inequality, when you talk to people about the environment or about climate change or about closing remote communities, don't forget health. And particularly when you talk to politicians or people in positions of power that make decisions, remind them of health. Because in the end, health really is the most important thing that we have. Thank you.